Hi, this is Dr. Upendra Kaul. I'll be talking about few commonly asked questions regarding heart failure and which are very important for all of us to understand. Heart failure is universally a big problem in most of the countries about 1% of the population gets affected by it. If we look at our country, we should have at least 12 to 13 million patients with various degrees of heart failure. Now, heart failure, uh, on an average, in India, the average age is about 52 or 53 years, which is at least 10 to 15 years lower than the universally, known age for heart failure in the Western world. Not only are they young, but they are sicker. Their mortality in the hospital, once a patient with heart failure is admitted for heart failure symptoms, the mortality can be as high as 30% as compared to just 4 to 5% in more, industrialized countries. And the annual mortality of this is also about 20 to 25% of our patients are lost within a 1 year of diagnosis of heart failure. So these are all very, very important problems. And it is continuing to increase because the incidence of diabetes in our country, which again has 65 to 70 million patients of diabetes, high blood pressure, every third adult in our country is a person with high blood pressure, and several other comorbidities like a previous heart attack, rheumatic heart disease is still not eliminated from us. We have many patients with thousands of patients with rheumatic heart disease. So all that leads to marked increase annually in the number of patients with heart failure. Diabetes is a very common association of heart failure. Any long standing diabetic has a very high chance of getting heart failure. And almost every diabetic who has more than 5 years of diabetes has some subtle features of heart failure. The diagnosis of heart failure is not difficult. Its recognition and its awareness is much more important. Now, any person who was absolutely asymptomatic and starts getting shortness of breath or difficulty in breathing, fatigue for no other reason, one should think of whether it is related to the heart. And there are simple, biomarker tests these days, like blood tests like beta natriuretic peptide, such tests, and also troponin estimation, which are very often can be used as tests of what is called as the very easily done tests on the bedside. They can be done as point of care tests and they can diagnose the heart failure. The importance is increasing because management of heart failure is showing many new ways of treating these patients, making their life more comfortable, reducing readmissions after heart failure, and also improving the survival. We started with ACE inhibitors like enalapril, lisinopril, ARBs like candesartan, we have telmisartan, and many such drugs like number of agents like ARNI, the sacubitril valsartan combination, all improve the survival in heart failure. Beta blockers are one of the most important drugs for the management of stable heart failure. They prolong survival markedly. Then there are drugs like SGLT2 inhibitors, which basically were used for diabetics. But then we know that even in non-diabetics with heart failure, they improve the all-cause mortality, the cardiovascular mortality, rehospitalization rates, emergency visits to the hospital. So all these new things are coming, and that is the reason we should be aware that heart failure, which is a major problem with a high mortality, is being treated much better as compared to what we were treating it 10 years ago. So I think heart failure should always be kept in the back of the mind by any physician who is dealing with patients with any kind of disease, especially high blood pressure, diabetic, previous heart disease, and the general public also should be aware that this is a condition which is uh, not difficult to diagnose, and also we have better avenues for therapy. Thank you very much.